Everyone, welcome to DHN, and we are here at DHN Forum Mumbai, and we are joined by Mr. Anoop Lawrence from Gleneagles Hospital. Welcome, sir. Welcome to DHN Forum Mumbai. I hope your experience has been great so far. Uh, I heard your session. The session was very interesting. One of the points that you made in the session was digital health strategy of a hospital depends on their model, healthcare organizations model. I want to ask you, what are the initiatives that Gleneagles Global Hospital has taken focused on patient experience and transformed them into digital health strategy?
So thank you so much for inviting me for this forum. As I had mentioned in the discussion earlier, that digitalization is very important provided you know exactly what stream that you want to factor to, because you can't have it very open. So I'll tell you a few steps that we have taken, especially at Gleneagles, because it's a larger group. We have hospitals based in Singapore, Malaysia, in the country, and also in Turkey and places like that. So since we have a very active program when it comes to transplant, which currently is not that great with our other hospitals. So this gives us an opportunity to touch base the clients which are based in those countries, those continents, which currently doesn't have an active program. And rather than having the patient come into the hospital direct, we are able to reach them digitally. We're able to connect with them digitally, assess them digitally. And based on that, we're able to build in a treatment plan. So this gives an opportunity to a lot of patients to seek phenomenal healthcare, good clinical outcomes in our country, in our institute. So that's one thing. Second, as we really know that healthcare is a very complex field, especially after COVID. Getting the right set of people skilled with the right attitude is very difficult. So there are countries, there are institutes which are having a breed of skilled and experienced, mature healthcare professionals. So what we are doing is, we are licensing with our counterparts and providing them that support that they don't get to have it in their own countries. For an example, my team sitting in Mumbai can help read a report, an MRI assessment, an MRE for the liver, talk about the CD brain and things like that for our people who are based in different continents, help them, give them a clear clinical outcome, especially because there is a breed of skilled, well-experienced radiologists in certain part of the country, not in India, but other countries, where my team is able to digitally support them. So that's something that we have seen, which is very active. That's another thing. Another way of looking at it is coming with a lot of data analysis, which can help us create a very good treatment plan for the patient. So we are working very closely with an institute which is helping us create a wearable device which will help our patients who are ailing with a specific ailment transmit us reasonable data, which will give us a clear picture about how the patient is doing, whether he's progressing or whether he's recovering. And based on that, I can connect with the patient and tell the patient to seek for medical attention ASAP, or give him the good news that you're doing very well. So these are the things which we are doing it. And this is helping us build up a very good customer satisfaction when it comes to the critical care patients who are in such situations.
So one interesting point that you mentioned is that you are dealing with patients in different countries. Culturally, these countries are different. The expectations of patients are completely different. So whenever you are deciding on strategies for these patients, are these strategies ubiquitous for patients across all the countries, or you have to have a tailor-made specific different strategies for patients in different countries?
You're right, because see, there are different cultural backgrounds, boundaries, expectation that you get to see with patients all over the world. Even in our own country, it is very difficult for a patient who is from Mumbai to go down south and take a treatment, because the food habits are different, the dialects are different, the climatic conditions are different. So such challenges are very common in our country also. And when I talk about overseas patients, they come with the same challenges. Only thing that makes a little different over there, and I think maybe the essence is the same over here also, when a patient is exhausted with all his options in his own country and he does not get the support that he is required to get, he would reach out to different other expertise. And in such situation, the patient would actually keep his comfort aside and go for the clinical outcome, which is the most important thing. Yes, how do I make it better? Is if I'm able to get him the same set of expectation that he would get in his own country, it will clinically heal him mentally, physically, and orthopedically, our team will take care of it. But that helps the patient much transit well from his ailments to a recovery phase when he has a place setting which is comfortable for him. It can be the place he stays, it can be the meal he takes, it can be a basic thing like the literature that he would end up reading. And if he has a translator who's able to connect with the team. Today, I'm telling you, I see a lot of patients who don't require a translator. They take the help of Google and then they're able to translate what they're required to. And it makes it very easy. This is the best thing that has happened in digital is what I would say so.
Absolutely. So when we talk about patient-centric approach, like you rightly mentioned in your panel discussion, that earlier hospitals used to be looked at as a disease management organization, disease management centers. Now, after COVID especially, even in India, we are taking more proactive approach. So when we talk about proactive approach, what are the elements that constitute in that?
So I'll be very honest. There is a transformation of healthcare which has happened over a period of years. Now, it is not only in healthcare, it is in every aspect. There was a time when we were dependent on those landline phone calls. You had those dial phones and then it transformed, then you got the pagers and now you have a mobile phone. Now we have all swanky things around. So the transformation has happened. But the bottom line is, the instrument was used to communicate. Similarly, healthcare is an institute where a patient would want to enter, not at his own will at this point, because nobody wants to come to an hospital very honestly, except for the ones who work over there. So when a person has to walk into an institute, because he knows it very clearly that I have no choice, all the remedies that can be locally availed from the local setups, from the GPs and all, has failed, and now I have to enter into an hospital. The most important part for that patient is to choose the right institute. Now, when he says that I have to get admitted, he will have an opportunity of getting admissions in multiple centers. Like you'll have centers like disease management, someone who's focused into total experience. I can only make the patient, help him take his decision to ensure that he comes to a place setting which is at his ease, comfort and expectation. So in today's world, when we focus so much on total experience, my aim and objective would be to make sure that I'm giving an opportunity to the patient that he knows that I have to get hospitalized. Help him choose which is the best place to go as per his customized requirement. That's what we do it. It's not that those centers who do disease management are doing a bad job. They're doing a fantastic job. In fact, I would say so. The government institutes, the corporation institutes, the primary healthcare centers, they are actually helping us battle out 90% of the ailments. The remaining 10% is the private institutes, which I'm part of one. I can only give them an experience is what I would say so. So someone who wants to walk into one institute for a total experience would find it difficult to walk into an institute which is into disease management and ask for a free Wi-Fi and, a chef crafted meal and things like that. So that's where the benchmarking happens. And I think my focus is towards providing a total experience. And that's where we are in, is what I would say so.
Absolutely. Sir, as a CIO, when, like you rightly said, even today there are people, when they hear the word hospital, there is certain sort of a fear. Something big has happened, then only I'll go to a hospital. So as a CIO, when you're dealing with this problem and you have to implement digital strategies in your organization, what are the 5 things that you look at?
So I'll tell you very honestly, one, I'm not a CIO, I'm an operator. I'm the chief operating officer, so the CIO reports to me. So there are 5 elements that we look at it when it comes to digital. The first element I would say so is towards research and development. Another one is to build a brand image. 3 is what I would say so, how do I ensure that I reach to masses that is really wanting me to help them. 4 is putting my systems into place, a process. And the 5th and the most important thing is with respect to modernization. with respect to making it easier and compatible for a patient so that he or she doesn't have to run pillar to post. The TAT is controlled, the turnaround time is monitored, and he or she, see, today's world is such that people want instant remedies. Instant remedies don't work out because there is a time that your body requires to actually adapt and respond to that also. But yes, if I'm able to diagnose it quickly, if I'm able to pinpoint the issue that he or she's been, getting affected with, then my line of treatment starts early, which earlier, with the use of sthetho and examination, and followed by certain add-on investigations, the doctors were able to find out. Today, we get straight into the investigative mode, which may look a little heavy on the patient. But I'll tell you, that cuts out a lot of considerable, valuable time that the patient will have to spend in the hospital to about 50%. So that you have identified the exact problem and the line of treatment has started. So this is very important 5-factor, I would say so.
When we implement digital strategies in a hospital, change management becomes one of the key points here. Change management with your staff, doctors, nurses, how do you suggest, what is the best course of action to implement that change management?
So there is two ways. One is my way or the highway, which used to work in the earlier days, which I don't agree to today. But then I'll tell you a very classic example, like just putting it on a personal note. Like my dad, if he has to travel to his native, he's still not comfortable in traveling in an aeroplane. He still prefers to travel by a railway. Today, when there is an opportunity for me to actually book his tickets online, digitally, he doesn't prefer that. He still likes to go to the counter, pay for it and get the hard copy. This is what it is, because there is something in his mind which deters him to adapt the digital modality. How do I change him? Very difficult. One of the reasons he's not wanting to change is because maybe at his age, maybe he's come to a level where he says, I can't change. So we face the similar problems and issues when it comes to going digital in an institute, let it be an healthcare institute or any other institute. Adaptation is something which is very, very difficult, provided he or she understands the salient points of having going digital. I'll tell you, pre-COVID, for an example, for me to organize a virtual consult of a patient with the doctor was so difficult. So difficult. Today, most of the doctors prefer virtually because they have realized it cuts a lot of time. It makes it convenient for the patient. The patient doesn't have to come all the way to the hospital to meet up with the doctor. He's reachable unless and until the doctor feels that he actually has to physically get admitted. Or else what the doctor would say is, get these tests done and see me if it is required. Or transmit it to me via WhatsApp or via whatever model needs to be. For nurses, monitoring health is the most important thing for them. So there's a lot of times where the nurses are able to actually pick the signs very quickly. There was a time they would talk to the RMOs, the RMO will do their assessment, then pick up the phone and speak to the doctors and things like that. I'm telling you, WhatsApp has been a savior for many of us. Every data that requires attention is transferred within the group. As long as it is reserved, as long as it is encrypted, there is no problem. And people are adapting to that. The younger generation prefers it more better than in the older one. But I'll tell you, there's a lot of older generation who are so curious to get into it and they're taking it very positively.
Absolutely. Sir, my one last question to you is, how can organization like DHN help you as a professional or your community in furthering the conversation regarding digital health?
So I think the role that you will end up playing is to create an awareness, is to make people understand that healthcare, like how in other sectors are, like I was giving an example, I don't think so when was the last time I actually visited a bank. I don't remember when was the last time I actually wrote a check. I remember. I wrote a check because I had to make the payment for my son's school bus fee because we have to do it on a pro rata basis. I don't remember when was the last time I actually used an ATM. because a lot of things get, worked up digitally. Yes. At the same time, it has to be a very safe process, and you should not get muddled into a situation where there is someone who's trying to take an opportunity to, rip you off. So similarly, I think that awareness needs to be created in the minds of the people, where they can be told that gone are the days where you have to actually go down, physically stand in line, pay 40 rupees or 100 rupees and meet a GP to get the. A lot of things can be availed at your fingertips. A lot of things can be looked at your fingertips. And there may be an opportunity where you actually don't have to visit an hospital unless it is required to. So that creation of the awareness is something that I would say. So today, I think maybe only 1 or 2% of the whole nation is actually digital when it comes to health. The remaining 98% is not aware about it. So I think that's something that you can do.
Thank you. Thank you so much, sir. Thank you so much for your time, and thank you so much for being part of DHN.
Thank you so much. Thanks a lot. And I'm sure you'll continue to do the good job that you guys are doing. Thank you. Thanks a lot. Thank you.